Two quick things. As Gene said earlier, you know, the American Rescue Plan is an insurance policy, but the other piece is a down payment. It's a down payment for our schools, a down payment for housing, a down payment around income support, and a down payment around childcare and what we need to do in the childcare industry. So while, you know, when you put down a down payment, you need to go get the thing you really want and not go get the part of the thing. You go get the house you want, not the house you don't want. So we need to actually continue to support our local elected officials and grassroots folks to put programs together about what we actually want and continue to build towards the political will and the public will for that. But the last thing I'll say is that we have to be clear that the American Rescue Plan, the success of it is not going to come down to the numbers and statistics. It's going to come down to the story of the success of this program. And right now, what we are wrestling with is, do people believe that government can work for us? That is the actual story that we are wrestling with. And what we have to contest with, while there is a larger narrative around the global economy, is that government can work for us. That means that we have to get down into the trenches, into the grassroots, tell the stories of the humans whose lives have been transformed because of these investments. And if we cannot tell that story, then Americans will not know that that government can work for us. And that is actually not only bad for policy, that's bad for our democracy. So we have to take up that role and make sure that we are pushing the stories around the success of these programs and make sure we're getting the right people telling the stories to the communities. You know, I was sitting here as I was hearing all the statistics and the impact of the programs. There was some names of some women that came to mind behind those policies and those statistics who actually have lived this impact. Our organization, we organize, we're the largest community organizing organization in the state of Ohio, organizing students and young people, formerly incarcerated folks, people of faith, and women of color who are workers in the childcare industry. And I was sitting here thinking about a conversation I had with a provider just months ago before some of the programs were implemented. And she had to sit down with one of her teachers, her early learning teachers, who was having a conversation with her about a 2-week notice. And the 2-week notice wasn't because she was unhappy with her workplace or she didn't care about supporting and raising children. She was a mother of a kid, and she had just got a $1 raise from $11 to $12. And the decision she was trying to make is that, am I going to be able to afford childcare and housing with this $1 raise because I'm receiving less benefits because I don't make enough money? And this childcare provider is trying to actually sit through and reason with her, trying to think of a reason to actually say she should stay. But she knows the truth is that she couldn't pay her more and that her situation could not be fixed because she was at the intersection of a number of different issues: housing, benefits cliffs, and support for children that we're trying to get back into childcare. And when we talk about those statistics, it's women like her that I think of. And part of the reason why I know it's true is because that woman is also my sister. I see that impact on Black women across Ohio every single day. And part of what has been so amazing about the American Rescue Plan, it has set forth a precedent about how we can actually deal with equity in our communities. And so I'll take a little bit back because how we started to address this at the local level, especially in Franklin County, which I'm going to talk about specifically, it didn't start the day the pandemic started. Many families and childcare providers, specifically that industry, has been struggling for years. Ohio has one of the lowest market rates, which means they're not getting paid the amount of money and don't have the sort of collective bargaining that they deserve to support publicly funded childcare. And so imagine when a global pandemic happens and hits and devastates that industry even further, and not only them, but families. You know, in Franklin County, only 40% of the children are ready for kindergarten. And a third of those folks are communities of color, Black communities, and also folks who are living in poverty. And so if you don't have children who are prepared for kindergarten, going into a global pandemic with an industry that is already on shoestrings, then that whole issue is exacerbated. And what we saw in the pandemic is that providers were closing up shop everywhere. I mean, even 173 providers closed in Franklin County. These are folks who are not only just taking care of our children, they're raising and educating them and getting them ready and also supporting the workforce of people getting back to work. But part of what I'm so excited about what happened in Franklin County is not just about the resources that came in, but about the steps that were taken beforehand, and then I'm gonna talk a little bit about courage. And so in 2020, Franklin County declared racism as a public health crisis. And now, while many may think that is a symbolic move, it was actually the first step of realigning our orientation, as you said, in 2010, reimagining our orientation towards how do we actually create public policy solutions that actually sees racism as the core part of it. And so while we were working in 2020, we were pushing and advocating. Our child care providers were showing up at the state legislature trying to get more dollars in. And when the American Rescue Plan came down, we started to analyze and figure out where we could really push and move forward. And luckily, we had child care champions like Commissioner Crawley, which you'll hear later, who have been fighting at the state level around child care. And then when we had those champions come down to the county level, we actually had an opportunity to move it. And the difference between a lot of money coming into community and a historic change is courage. Because what we know is that public policy requires someone to take a chance on innovative solutions to see if it's going to make a difference. And part of what this program has done has created that. So particularly, I was talking about the Franklin County RISE program. And so while we've been fighting for years for childcare, the historic investment of $26 million that came into became available because of the American Rescue Plan money for local localities, not only addressed the issue of the childcare industry, but a holistic approach to how we actually address equity in a county like Franklin County. So remember that teacher I talked about who was struggling with housing and not having the benefits or the wages. This program, Franklin County RISE, addressed all three. First, it dealt with families who need scholarships to be able to afford to get their kids into childcare. And not just any family, specifically the cliff effect parents, like my sister, who if they make $1 more, which we may think that those wages will go further, but they're actually losing more benefits. This program focuses on the majority of women of color who are losing more money by earning a small amount of a wage increase and making sure that they have at least $10,000 that can go towards childcare. The second piece is supporting the actual workforce of providers. Providers through incentive rewards that allow them to do capital improvements and program improvements to their child care centers to make sure that they can not only earn more money through this program, but also have quality services for the child care providers. And the third piece I think is the most innovative piece of part of it was that knowing that while wages is a thing that we're going to have to wrestle with and fix, that's a state issue and that we need to really work on, that people still need relief right now. And so women like the women who had to figure out how to keep housing, this program had a third component which had emergency rental assistance for early learning teachers. So specifically those women of color who are in this industry who want to stay in the workforce, but are trying to decide if they can pay their childcare, their housing, and raise children, that they actually have a wraparound program that could keep them in the industry and stop some of these disparities that we're seeing happening. And to me, this sort of program is an example of the courage of local government using resources that are coming down federally, working with grassroots groups and providers who have known what the solutions are for years, and actually developing a program that can move the needle and has already moved the needle in this county. We're not going to see the sort of impacts of this program for years to come. I remember when Dorian was talking about the the telescope earlier, it made me think about how what's so innovative about this telescope is that it can see new galaxies, but it's because humans can't see infrared lights. We can't see that. The telescope is built to do that. Part of why this program is so great and why the resources that have come down the local level, it is infrared lights. It's not only insurance policy to move through this particular moment of trying to stop a recession. It's a down payment in our future, which means we can't even see yet the full impact in 10 or 20 years that this money is going to make on our communities. And that is what local government is doing, to actually create innovative programs with good policy, working with communities to make sure that we have the infrared lights to see our future and walk towards it.